afternoon. Today, I would like to discuss with you the coronavirus, but more specifically, the COVID-19 that has been plaguing our world these last few months. Every country is responding to this virus in different ways, but America has taken a very distinct approach to taking care of its economy and its people. On March 27th, a historic $2.2 trillion bill was signed into law that would affect the people and business of America in big ways. One of the biggest parts of this bill was introducing money back into the economy that would then boost businesses and companies again. This was done by giving $1,200 cash payments to all qualifying individuals. The qualifications were decided by 2019 tax returns. In 2019, if you filed as single, you would receive a payment if you made less than $99,000 that year. If you filed as a head of household, that'd be $136,500, and $198,000 if you filed as married. Also, all individuals applying for unemployment can claim an extra $600 per week throughout the end of July. This puts money back into the pockets of American people so that they can continue to pay their bills and also spend money supporting local businesses. Another huge impact the stimulus package had was on small businesses. Small businesses were especially struggling during this time in a number of ways. They didn't have spare income that big businesses had in order to stay afloat. Most small businesses make just enough money to pay bills and employees. Small businesses also have a much less loyal customer base to keep up their income. A lot of small businesses also had a good deal of pressure from big businesses wanting to buy them out. The stimulus package helped out in several different ways. First, the stimulus package directed $349 million towards creating low-interest loan options for up to $10 million per company. The package also gives tax deferrals. The CARES Act made it so that tax payments would not be due until October 15th of 2020. The package gives a 50% refundable payroll tax credit back to the companies and also gives good sick leave compensation to the small businesses, which is part of a variable based on the number of employees the company has. These are all ways that this historic stimulus package helped out individuals as well as small companies.
Hi, my name is Essen Nadeem. I'm going to be talking about the $2 trillion COVID package concerning the healthcare industry. So we're going to be talking about the overview, which includes stimulus package breakdown and healthcare breakdown, why to healthcare package for healthcare and hospital needs, what to do with healthcare needs, and what to do with hospital needs. And then finally, we will be talking about the conclusion. So we're going to start off with the $2 trillion COVID package breakdown. So starting off, we have individuals and families, which are being paid for a total amount of $603.7 billion, with a share package of 30%. Big businesses coming with $500 billion, and with a share of the package of 25%. Small businesses with $377.0 billion, the share package of 19%. State and local government with $340 billion, with a share package of 17%. Public services is at $179.5 billion, with a share package of 9%. Stimulus package for healthcare hospitals. Public services hospitals have the highest with $100 billion. Then comes out Veterans Healthcare with $20 billion. Stockpile equipment with $16 billion. SNAP, which is Supplemental Nutrition Assistance Program, that comes out at $15.5 billion, and drug access at $11 billion. Why hospitals? The biggest part of the package goes to hospitals, who will receive $100 billion in grants to help fight COVID-19. This was a major ask from groups representing the healthcare industry as they look to make up the lost revenue caused by focusing on the outbreak. There will be also a 20% increase in Medicare payments for treating patients with the virus. Healthcare needs. Protective gear for healthcare workers, testing supplies, and emergency operation centers overrun by massive influx of patients, funding to help prepare America's healthcare infrastructure for the coronavirus. It also includes Medicare payments, telehealth and home service, Center for Disease Control and Prevention. As far as hospital needs go, the cost for caring for COVID-19 patients is significantly higher than that of other patients due to the complexity of the illness. Elective cases are the primary source of revenue for many hospitals, allowing them to take on loss or certain services while remaining profitable. Researchers estimate that 90% of the hospitals that cancel all elective procedures will shortly begin to experience negative profit margins from COVID-19 cases. The analysis shows that there will be an average loss of about 1,200 per case and up to 6,000 to 800 per case for some hospital systems, depending on their payer mix. Continued costs are also being driven higher due to expanded cleaning regimens, more frequent X-rays and CT scans, and overall higher supply and drug costs. Many hospitals will not be able to survive the damage to their cash flow for longer than 60 to 90 days. A majority of hospitals would have little choice but to engage in massive layoffs of non-clinical staff to stay afloat financially. The worst-case scenario would result in 97% of the health systems losing an average of 2,800 per COVID-19 case, with many losing between 8,000 and 10,000 per case. In conclusion, the stimulus package provides a $100 billion public health and social emergency fund to reimburse hospital for expenses and lost revenues related to the coronavirus pandemic. About $65 billion will go to the hospitals, with the rest funneled to doctors, nurses, suppliers, and others. Provide reimbursements by 20% of treating Medicare patients with coronavirus, and it eliminates $8 billion in scheduled payment reductions to hospitals caring for large numbers of uninsured and medical patients, as well as temporarily removing 2% cut for treating medical patients. Thank you.
Division C of the CARES Act goes over the assistance to the severely distressed sectors of the U.S. economy. This portion is also known as the Coronavirus Economic Stabilization Act of 2020. So what industries are distressed? Well, pretty much all of them, but the severely distressed industries right now are mining, transportation, employment services such as HR, travel arrangements, and leisure and hospitality, because we're all kind of trapped inside. The portion of this that is the relief, so businesses that are directly affected by the coronavirus and are taking losses right now, they can get loans up to $208 billion combined. So air carriers, they break it down. There's $50 billion available to passenger air carriers and $8 billion for cargo, and then $150 billion for any other companies that need assistance. Now, the U.S. Secretary of Treasury, Mr. Steven Mnuchin, I'll never say his name right, is the one who reviews applications and decides who will get the funds. And he had 10 days from the day the enactment went into effect to publish how these applications would work and the minimum requirements for filing. Part D goes over the government's protection, of course. The government's giving out money, it's going to want some protection. So the government's compensated for the risk here by participating in the business gains via equity. So any businesses that are successful, the government will get a portion of their equity, either through stocks or whatever it is. And then the money that the government gets back from these businesses, air carriers, like if they're paying interest on the loans, those funds will go to the Airport and Airway Trust Fund, and then all other businesses, the funds will go to the Treasury. Mr. Stephen also got $100 million through this for used to basically administer the whole program, whoever he needed to help make this happen. There's also limits on employee compensation. So anyone that made over $425,000 in 2019 cannot make that much or more for 2020 to 2022. If they leave the company, they can't get twice that in a severance package. The compensation is defined here as salary, bonuses, stock awards, and financial benefits. These are some other little pieces of it. So continuation of certain air services. The Security of Transportation is requiring any airlines basically that are using these loans, they have to continue their scheduled flights as they had already planned. And then there's reporting for this. So the Secretary will make reports as needed, and then the Comptroller General conducts loan studies and reports to 6 congressional committees every year. The Secretary of Treasury also is required to coordinate with the Secretary of Transportation on all of this. And then the last part of it is Division C, Title II, Aviation Excise Taxes. So there's suspension of certain taxes. No air transportation taxes can be claimed through the excise tax holiday, and no kerosene taxes for commercial aviation are allowed. The holiday period here is from the enactment, which was March 2020, to January of 2021. So these things are all tax-free. So we've gone over what the stimulus package is, how it affects families, businesses, the healthcare industry, and the distressed sectors of the economy.